everyone, this is Dr. Reva. Today I will be talking about a common summer complaint, that is a urinary tract infection. Now UTI are divided anatomically into two parts. One is the lower urinary tract infection and there is an upper urinary tract infection. The lower urinary tract infection includes urethritis, cystitis and prostatitis, while the upper urinary tract infection includes acute pyelonephritis and perinephric abscess. Now, what happens in UTI is there is a presence of more than 10 raised to 5 organisms in a midstream sample of urine that is called as a bacteriuria. Now, this bacteriuria can be asymptomatic and can be symptomatic. In asymptomatic bacteriuria, you only have more than 10 raised to 5 organisms per ml of the urine and no other symptoms, and it commonly occurs in pregnant women, while the symptomatic bacteriuria can be presented as acute cystitis, pyelonephritis, urethritis, and septicemia with septic shock. Now, the most common agent which causes UTI is E. coli. Others are Klebsiella pneumoniae, gonorrhea bacteria, and chlamydia infections. Now the pathogenesis. Now, how do the bacteria go inside to form the UTI? The bacteria gain entry through the urethra to reach the urinary bladder, and that's how the symptoms of UTI develop. Females are more prone to develop UTI because of the shortness of the length of the urethra, and there is the absence of the bactericidal prostatic fluid, which is present in males, absent in females, and sexual intercourse also leads to UTIs. Then there is presence of foreign bodies such as catheters or cystoscopy tubes, etc., which can lead to UTI. Then can be vesico-ureteric reflux also leads to UTI. Diabetes mellitus and certain neurological disorders also lead to UTI. UTI is presented to us as fever with chills and rigors. There is flank pains. There is increased frequency of urination. There's dysuria, hematuria, and urine can be cloudy in appearance in certain cases. UTI can be divided into two types. One is uncomplicated, one is complicated. Uncomplicated is presented as cystitis or urethritis, while complicated, no matter where the location of the UTI is, there is some underlying pathology along with it. Uncomplicated occurs in females, while complicated occurs in males. And uncomplicated is easy to treat. There's no sequelae, while in complicated, there can be complications like a metastatic abscess, etc. Now, investigations. How do you investigate a UTI? There are basically dipstick tests in which you can test for nitrate and leukocyte esterase. Presence of either of these is an indicator for UTI. Secondly, there is a clean catch of the midstream sample of urine in order to check for the leukocyte casts, and red blood cells. There is gram staining and bacterial colony count, and there's culture sensitivity tests. Other special tests include the rectal examination for prostatomegaly, a prostate massage in order to check the urine for prostatitis. There's DMSA, there's renal ultrasonogram, and in females, we check them for cystoscopy. Now, the treatment part. In treatment, we advise the patient to drink more than 2 liters of water per day in order to encourage water diuresis. When there is a stone or any other foreign substance, we do not ask them to take antibiotics unless otherwise necessary. There are pain relievers, analgesics, and antispasmodics for your detrusor muscles. And in females, you encourage them to maintain a constant genital hygiene in order to prevent these urinary tract infections. Encourage them to urinate before and after sexual intercourse, and there should be complete emptying of bladder frequently. Thank you.